Assalamu alaikum. I'll talk about the steps of writing the progress note, and we will mention one case scenario to practice on together. But first, let's know what is the progress note, when to write the progress note, and why to write the progress note. Basically, the progress note is a daily note that has to be written and updated every day. Okay, and it's written once the patient is admitted to the hospital by the admission team, so they will write the admission note, and then it comes the job of the primary team to keep writing the progress note of their admitted patients until they are for discharge. Why to write the progress note? Actually, this note tells you how good or bad is your patient. So anyone can come after you and know about your patient from A to Z, okay? Either the primary team, nurses, or any physicians involved in your case or your patient, okay? So simply this is the progress note. It gives you an idea about the progression of your patient during this day, okay? Now we can move to the steps of writing the progress note. And I'm sure that everyone knows what is SOAP, but let's recap together. So it's subjective, objective, assessment, and plan, okay? And the difference between subjective and objective is super easy. Subjective is any information related to your patient, okay? Meaning age, gender, any known diseases your patient might have, procedures or operations your patient went for either in the past or currently, outside the hospital, inside the hospital, outside the country or inside the country, okay? And then the last part in the subjective, which is the medications. So any medications your patient is on, either home medications he's still taking or hospital medications he's on during his admission, even if only an IV fluid should be written here, okay? And then let's move to the objective, and I call it the physician's view. Why? Because you cannot get answers without checking on your patient. First, you have to go and check on your patient, and then you can write it down, okay? So you have to go and ask, and you have to go and examine, okay? Without checking on your patient, you cannot get answers for these two parts, okay? And then we have the last part, which is the investigations. Any investigations done for your patient, you will write it down here. If the investigations from labs or radiologies are pending, you will say the following, either labs or radiology, and you will mention it specifically, and then you can say pending, okay? If resulted, you will write it down. The assessment is a summary, okay, of your subjective and your objective, plus the major part of the plan, okay? I mean, this patient for what exactly? Like if solved, your patient will be discharged home, okay? And we will see that. The last part of the progress note is the plan, and the plan can be from 1 until whatever, depends on the case, okay? And I prefer to write it down in order, especially in the surgical specialties, because some OR patients or patients for OR, they will have specific plans should be received in order before they push to the OR, okay? And if I miss to write that, the nurse will miss to give, okay? This is simply what is SOAP, okay? Now we can move to the case scenario that we have and practice. So let's say that our baby here is in the ED now, and the ED called the admission team to see the patient. Okay? They told them, we have 1-year-old baby boy with productive cough, shortness of breath for 2 weeks. Mother mentioned that the baby has decrease in oral intake and vomiting since his presentation. Okay? So the admission team came and saw the patient. They decided to admit this patient for the following reasons. They said the patient has decrease in oral intake and he seems to be dehydrated. Second, the patient was in respiratory distress and should be managed. And they said, we want to investigate for pneumonia. So if yes, they will treat it in hospital setting. Okay? So these are basically the reasons for the admission. Let's say you came next day as a new intern. Okay? First day for you in the hospital, and the primary team or your primary team told you, okay, to see this patient, and the resident told you you will be the one responsible for this patient until his discharge. Okay, you will check on this patient every morning. You will ask this patient and examine this patient, okay, every morning, and you will write the progress note of this patient, and probably you will present it during the round. Okay, so what to do as first day training in the hospital, first case to take, and first progress note to write. What I advise you, especially if it's a first progress note to be written in the file of the patient, I advise you to go and open the admission note. Okay, because the resident will not tell you all the information about the case. Okay, he will tell you only the presentation that the patient came with and the diagnosis, and that's all, and the room of the patient. Okay, so you have to go and check on the admission note. Okay, so I see it's smart to check on the patient file before you go and step into the room and check on the patient physically. Okay, because that gives you an idea about your patient, like, is there anything special you need to know about this patient? Okay, so when you checked the admission note, you found that the patient is Down syndrome. He's known to have congenital heart disease. Okay, and he was admitted here 1 month back for oricopexy. Okay, so these informations the resident may not tell you about. Okay, so you have to go and check it. Okay, so now let's move to write the subjective, and there is some common words. I'll use the red color so you can know. Okay, so in the subjective, what you will write, as we mentioned before, sorry. Okay, so as we mentioned before, age, gender. Okay, so we will write 1 year, sorry, so 1-year old boy. Okay, and since he's a baby, you have to write if he's full term or preterm. Okay, So 1-year-old baby boy, our case full-term baby. Okay, and then there is a common word here to use, which is known case. Okay, so known case of, we said Down syndrome, congenital heart disease. Okay, so known case of Down syndrome, and I better use the disease fully, so sometimes it can be mistaken. So Down syndrome, congenital heart disease. Okay, and then here's another common word, which is admitted. So admitted as case of. So our case scenario, he was diagnosed with pneumonia. Okay, so admitted as case of pneumonia. We will discuss, or we will explain each common word, so you can know what it is exactly, and you can use it easily. Okay, and there is the third common word, which is status post. Okay, we will see what is status post, or what we mean about status post. Okay, so status post, we said he was admitted in the hospital 1 month back for uricopexy. So uricopexy, see, 1 month ago. Okay, and then the last part is patients on, or you can write on directly, and here you will list all the medications that your patient is on. Okay, and here you will write the name of the medication, the dose of the medication, the route of administration, and the day, especially in case of antibiotic, because the antibiotic is a course and should be finished. Okay, so you have to write down the day. Let's now discuss each common word. Okay, so the first common word is known as, or known case of. Okay, known case of, followed by the diseases, okay, that your patient is known to have. And our patient is known to have Down syndrome and congenital heart disease. Okay, the second common word is admitted as case of, and this word, okay, if your case is clear enough and diagnosed already, you can write admitted as case of. Okay, as case of means that your patient is already diagnosed. Okay, but if the case still not diagnosed and under investigation, the case is queried, you will write what? Admitted. So admitted with what is the complaint or the presentation he came with or she came with, and then you can say for investigations. Tamam. Okay, the third word, which is status post. And status post, as we mentioned before, if you remember what we said, status post, we can write the procedures, the operations that the patient went for. Okay, so here our patient went for uricopexy 1 month ago. So you write the procedure or the operation, when, and if you know the place or the hospital, you can write it here. Okay? And then the last common word here in the subjective is on, which is the medications. Okay? And we mentioned you write name, dose, route of administration, and day in case of antibiotic. Okay? This is about our subjective. Now we can move to the objective. And we said the objective is what? Physician's view. And we cannot get answers without asking or checking, let's say checking on the patient. So we can ask, we can examine to get the answers. Okay? And here in the objective, we will have common words as well, and we will use the red color. But before that, let's move to our case scenario. Okay? And let's say we asked the mother, we went to see the patient, and we asked the mother if the baby still has vomiting. She said, no more vomiting, doctor. Okay, since his admission. And doctor started to tolerate orally. Okay? And then you asked her about any episode of cyanosis. She said, no, doctor. You asked her if there is any diarrhea. She said, no, doctor. You asked her if there is still productive cough. She said, yes, doctor, but not as much as before. And then you asked her about the activity of the baby. She said, I'm so happy, doctor. My baby regained his activity. He's interacting. He's responding. So yes. Okay? These are important informations to ask about. And then you ask her about very, very important questions, which is fever. She said, yes, doctor, my baby spiked fever yesterday night. The nurse came, she gave him a paracetamol, and then fever subsides. This is a very good information to ask about. And if you check the vital signs before you step into the room and ask the mother, you will see that. Okay? So you wouldn't ask about that, but you can ask, of course. Okay? So this is basically our objective. We will write what we asked and what we examined. And the examination, in our case, we will examine the general examination, of course, and we will do the systemic examination, focused systemic, which is the respiratory, cardio, and GI. If other systemic examination are indicated, you have to do it. Okay? Because our case is pediatric, you will do the development and milestone if the admission team did not do it. Okay? In our case scenario, he is Down syndrome, so we suspect an abnormality. Okay? So let's now move to write the objective. Okay? Sorry. So what is the objective? We will use here the first common word, which is, so patient is seen with, and you can write either the team or the resident, and what you prefer is okay. So patient is seen with the team, and I prefer to say is seen today. Okay, so patient is seen today, and then you can write patient is So patient is doing well. In our case, he was well. So patient is doing well, active, started, let's say, you can say as per mother, so started to tolerate orally, okay, no vomiting, no diarrhea. So everything we ask the mother, the answers will be here. So no diarrhea, no cyanosis, and then we will say patient spiked fever, and you will write down how much it was. Let's say 39, and you will write what was the root. Okay, so in our case, let's say axillary. Okay, and then you can say subsided with paracetamol. Okay, this is the first part, and then we can move to the second common word, and the second part is the vitals. Okay, and the vitals, of course, you know it: blood pressure, heart rate, respiratory rate, and we will comment on these two. So respiratory rate, oxygen sat, and temperature. Plus, I prefer to put the capillary fill time and the weight in case of pediatric or certain conditions in adult in this part, which is the vital, so not to forget. Okay, yes, about the heart rate and the respiratory rate, they mostly prefer to write it down in a range. I mean, the minimum to the maximum. Okay, let's say the heart rate is from, let's say, 60 to 90. Okay, and same in the respiratory rate. We can say it depends on the age, but let's say from minimum, let's say 20 to, so it's 16 to 20. Okay, so minimum to maximum. Okay, let's move now to the third part and the third common word, which is the examination. And we mentioned the examination, what to do. Okay, and depends on the case. Like if we have, let's say we have an adult patient, he's for surgical procedure, and you came after they done the surgery, they resected the resected part of the bowel. Okay, and they create a stoma. So in the examination, you will write the stoma examination. Okay, After that, we have the last part in the objective, which is the investigations. And as we said, the investigation, if pending, you will say the following, and you will specifically write down what are the pending labs, and then you can say the following are pending. Same in radiology, okay? So this is basically what is the objective. Now we can move to the assessment, and the assessment is very, very easy, okay? The assessment, actually, we will write it down in 1 to 2 lines, as we said, okay? And you may say, there is bunch of words, how to write it down here in 1 to 2 lines. You can do it, because there are some important words to be mentioned, not all, okay? So in the assessment, you will write, this is a 1-year-old boy, full term, okay? And then you will use the common words that we wrote before. So known case, Down syndrome, I'll abbreviate the words, okay? So Down syndrome, congenital heart disease, and then you will write down the common word, admitted as case of. So admitted as case of pneumonia. Okay. And then you will say patient is stable. Our case, the patient was stable, okay, except he had one spike fever and subsided with paracetamol, okay? So if patient is not stable, you will say, what is it? What is the situation actually, okay? And then you can write patient, or you can write directly on antibiotic course, and you can mention the name of the antibiotic, okay? So this is basically the assessment, nothing else, okay? As we said before, here, this part is from what? The subjective, okay? And then this part only describes our objective, okay? So only 3 words. And then this part is our major plan, okay? So if our patient is stabilized, okay, and he finished his antibiotic course, inshallah he can be discharged home, okay? So this part is the major plan of our patient, okay? Now we can move to the plan, and you should know that every plan should be discussed, should be approved by the team. You as an intern, you are not responsible to give a plan for your patient, but if you want to participate, that's okay and fine, but you have to approve it with your team, okay? So here's a common word to be used, and I prefer to write it down for my safety as an intern, okay? Because you have to write it down, okay? So what you have to say is, as discussed with the team, okay? And then you write down from when to whatever, and we will see how we can write the plans for our patient. Our patient, if you remember, let's go back. If you remember the reasons for the admissions, okay, we erase it. Okay, let's say here. So the plan of the reasons for the admission was: 1, decrease in oral intake. 2nd, patient had respiratory distress. Okay. 3rd, patient was investigated for pneumonia. Okay. Let's say these are the reasons for the admission, and the plans for the admission were: 1, put patient on IV fluid. Okay, patient is in respiratory distress, we have oxygen, put patient on oxygen, and they will write down the rate of oxygen, etc. Okay, and then patient suspected to have pneumonia, so investigate for pneumonia, do labs, and do radiology, chest x-ray. Okay, so basically these are the reasons of admission, and these were the plan for the admission. And of course patient should be for admission, okay, so they can do all of that. Okay, that's why I told you I prefer to write down the plan in order, because you cannot do all of that without admitting the patient. So first admit the patient, then you can continue. Okay, so in our case the plan will, we can do our plan as, let's say, so our plan will be based on our objective. Okay, so our patient is active. Okay, he started to tolerate orally. Let's say I'll put that in mind. Okay, and I'll tell you how to put it in your mind. And then he has no vomiting since his admission, no diarrhea. Okay, no cyanosis, and fever is there is 1 spike of fever, and I should put this also in mind, and we'll see now. Okay, let's say the plan of our patient during this day: 1, let's say off IV fluid. Let's before IV fluid, let's say, because we want to write it down in order. So 1, observe vitals. Okay, and then you can say observe vitals for fever. So they can document each spike of fever, and then we can say continue, because patient is day 1 on antibiotic, or day 2, so continue on antibiotic, and you will write down what is the antibiotic, okay? And then you can say of, since our patient is starting to tolerate orally, so of IV fluid, if, so that's why I told you just consider what the mother told you, okay? Because you want to confirm that. You cannot off the IV fluid without confirming that. So off IV fluid, F, okay? If what? If patient is tolerating orally, so we want the nurse to observe that. If tolerating orally and has no vomiting, okay? For we can say follow up pending labs, if there is a pending lab, okay? So follow up pending labs, and then we can say, let's say, start, just an example, okay? Start to wean off oxygen tomorrow, and there is a range, okay, not to go below, okay, so this is basically, we can write this is basically the plan, and this is an example of our plan in this case, okay? So this is the progress note, and I hope you all enjoyed this session, and maybe our case is not that perfect, and the steps of the progress note is not that correct or true, and same for our plan, but it just to give you an idea how to write the progress note and how to correlate your objective or the plan to your objectives, okay? Thank you.